Hi, my name's Jason, and I've been treating OP exclusively over Skype and Zoom for the last 8 years. So in a previous video, we talked about the true cause of OP. And I wanted to really get you open to the idea that yes, you may have overtrained, yes, you may have just had a baby, yes, you might play a lot of soccer, but that lots and lots of people play soccer, lots and lots of people run ultra marathons, lots of people have babies, and they don't end up with OP. And I tried to really drill down to the idea that you have OP, and people who develop OP have it because there are very specific mechanics that the pelvis needs to engage in when you are walking, when you are running, when you're doing things. And that people with OP, they don't do these mechanics correctly, that they have an unstable pelvis. And this unstable pelvis, so when they're walking, when they're moving, their pelvis does these movements in an unstable way. That instability leads to overloading in tissues like the adductors and the lower core and the sides of the hips and the hamstrings and the pelvic floor. Basically, area muscles and tissues that attach to the pelvis. This instability in the pelvis overloads those tissues that attach to the pelvis, and they compensate. They try to provide stability by bracing and tightening, but it doesn't work. And that this instability that leads to this overload of these tissues leads to the damage that we see in a diagnosis of OP, whether that's in an MRI or whether it's just from symptoms that you experience. And that essentially the answer to fixing OP is not to inject your pubic bone, it's not to go in and rest for a heap of time. It is to go and change those mechanics so that you move your pelvis in a way that is functional, and that by moving your pelvis in a functional way, you will stop overloading those tissues that keep getting damaged, and by not overloading those tissues, they will heal and you will feel better. In this video, I want to flesh that out a little bit more. I want to go into a bit more detail so you can start to understand the kind of ways that you need to be thinking if you want to recover from this injury. Now, if you haven't already, I'd recommend doing the biomechanical assessment video after you watch this one, just so you can get an idea of what it is that your body's doing that's leading to your OP. But I'm going to show you here some of the most common results that I see whenever I test someone. So the first one you're going to see here is a leg lift, and you're going to see myself lifting my leg up, and then you're going to see a patient lifting their leg up. And the thing you're going to notice straight away is that their pelvis shifts dramatically over to the side. And in doing that, you can imagine they are overloading their pelvis. So if my pelvis can be right here, and I can stay in the position, this pelvis stays stable, and this one rotates right, well then that's such an easier movement than if I, like my patients, would have to shift my pelvis to the side. My adductors attaching here, my lower core attaching here, all attaching to the center point, they're all getting yanked away. And the body's reaction to that is to try to brace and pull it back, and that is where the overload is going to occur. Now in the second test you're going to see the exact same issue, but you're going to see it from more of a core perspective. So when they lift up their hand, their pelvis should stay in the middle. And if you look at mine, you'll see that I'm able to do that. And when you look at their pelvis, you can see that they can't. And the issue there again is that when they are trying to do things like hold a weight or do something where you need a lot of core engagement, their body cannot keep their pelvis efficiently stable, whilst mine is easy. So you can imagine that every step that someone takes, every time they change directions, every time they kick a soccer ball, if they have these unstable pelvic mechanics underlying those movements, that they are just going to lead to that overload and going to lead to that pain that you see in OP. And that you are not going to recover no matter how many injections you get or how much rest you do until you deal with that underlying mechanical issues. Now, every person is different, every body is different, and everyone comes into OP with a different case. So if you're a professional soccer player and a good athlete, you may only feel your OP when you're really kicking the ball hard or when you're extremes of your sprinting. If you're coming off a pregnancy and your core has been disrupted by having a baby grow in it and other such things, well then walking might be enough to set you off. Either way, what you do know is that if you keep doing what you're doing, the problem is going to continue to get worse and worse because those mechanics are going to continue to go in the background and cause incremental damage over time. So whether it's today, tomorrow, or next year, you are going to have to pay for the consequences of that if you don't change those mechanics. And when you start thinking about OP from this perspective, you can start to tie together some of your gut instincts, some of the other problems that have been going on in your body that you know are connected to this issue, but you've never been able to express. So if you have an anterior pelvic tilt or some sort of sway lower back, well, what I can tell you is that that's going to put pressure in tipping your pelvis forward. What that does is that it creates force going down in a slanting angle towards the front of the pubic bone. So when you're walking, when you're moving, you're getting more force shunted towards that area that you're experiencing pain in. If you have overpronation, well then your knee drops in every time you run. And whenever your knee drops in, your adductors, which live along the inside of your leg through here, they're going to fire really, really hard to try to stabilize and protect from that knee dropping in. So obviously that will play a role if you're experiencing that kind of symptom with your OP. You can start to sort of trace together all these injuries and start to understand that they are all interconnected and that the pelvis is in the center of everything. So when I say that you have an overloaded pelvis and an unstable pelvis, it is because there are other systems in your body that aren't doing their job. And when you start seeing your body in this perspective and from this manner, you can start to understand that, oh, these interventions where I'm just trying to strengthen my core, strengthen my glutes, isn't going to work because I'm not addressing my whole body and I'm not seeing changes in the mechanics. So I've done hundreds of clams and then I do this biomechanical test and my hips are still swaying. And once you understand that, well, then you can start actually going towards solutions. You can actually start to take steps to get properly better. Whilst if you don't understand this problem, well, then you are going to keep doing things that might feel good in the moment, like a clam or a bridge, and you might feel like you're getting stronger, but you're never truly addressing the true cause of what's causing your OP. So I've been treating OP exclusively over Zoom and Skype for the last 8 years. Trust me when I say I know what you're going through, because I've been through it with over 1,000 other OP patients who are sitting in the exact same situation you're sitting in right now. Confused, annoyed, desperately just trying to figure out why you have this condition and what you need to do in order to get better. So I'd really recommend booking in for an initial consult with me. I charge a fraction of the cost that I would for a full consult. I'll assess you, I'll look at your movement patterns, I'll give you a good idea as to why you have this condition and some of the broad steps that you'd be taking with me if you're going to get better from it. And so even if you decide that I'm not the therapist that you want to go with, you'll be armed with the kind of information to make better decisions about the type of therapies and the type of therapists that you'd want to engage with in order to make sure you get better permanently.